viewers, it's your boy Mugabe GH live from Exhub Studio, ready to bring you trending news. And this time around, we are moving straight to, our health sectors. I don't say one of my colleagues, will get on well with me because I will blast them. Yes. So we are moving to, the health sector. I was saying, me blast you. What I say? Because it has been issues where they bother me since 90s. The issue has been bothering my mind. Where today I go blast them small. I know say my colleague be there if you hear him, you go can't fire me. But I go fire them before you can fire me. Yes, man is ready for war. So we move. Charlie, there's this doctor, Joseph Akwesi Boateng. He talks some matter. Where the matter where he talk, Charlie, it touch my heart. Because it be something where viewers, they fight for that thing. Me soon they be I say, why should our nurses be doing that? What I say, the question is, we are nurse. Your employer say be ye juma. Anything that we are nursing. Now say nurse na your system. Who call hospital? Or no crowd catch and say malaria. Besides, say, how do you know you have malaria? Who to go beside doctor Mwao? Say, I'm suffering from malaria. Say, how do you know you have malaria? Who to meet me? The reason why I'm here, by God's grace, me thank hospital one. When I was in JSS, somewhere 2004, me nya malaria bi, and I call school community hospital. The nurse asked me, say, malaria shall set time, ben. And I'm going so about 5 days ago. Anna, what if you are in the house and you are not coming? Look at that, it's getting severe. You are here. You come to disturb us. So after weighing me, I sat down waiting for her to come. She was not coming. So I think before she came out, I left. So when I was going then, I don't know whether the woman is their matron or what, I don't know. But she called me to come and asked me why. And I said, oh, madam, when him say, Mami, wait, because I said, me, I know, or son, you yam yakam. And to me, no move from hospital. Because I could treat him. And I'm quite a matter of body training in Manyama. And I'm that time. And from then, when me who will be always a nurse in this animal, I'm calling cannot move me some way. Because nurse needs to not pressing the phone. Or your TikTok. Oh, catch and say, oh, nurse, pacho, me papa crying the yard, no, but you know, or feel so disturbing. What I said? And this doctor is saying that as a nurse, you have no right to insult a patient. Viewers, mom, we are nurse, you have to be learning. You see, it's not about the uniform alone, or it's not about the name. After you going to the school, acquire the knowledge, when you go to the field, what do you practice there? Because when you go to your labs, the way you are active to get your, your GPA very well, you are active. When you come back to the hospitals, do you act like that? That is the question. What could school? School now, where we when you say, at the end of the day, you are coming to a hospital to work, and you know very well that you are coming to deal with human beings. This is a big issue. But you see this, our nurses, they will be there. What's your? What the emergency crab? Not your. Not hearing the phone. What do you call high? But your national identification card, not next by honoma, or pentama course, or no, the duty, no, national duty, and you also enter no hospital. You see them in queue. They cannot, oh, me I say, I'm a nurse. Then why? Because I'm office. But when they go to their office, they refuse to attend to the people with immediate effect, and that is their problem. So I know that most of these nurses will come for me, but I'll tell them my mind before they tell me their mind. As I said earlier on, I don't care. You see, so they are one of the senior doctor is saying that the way they treat patients at the hospital is poor. And it is poor. Sometimes I will take you guys around one day and then we'll enter the hospitals and you see how they treat patients. Obi ono yare na waba na wodi no. Or say on kwaji file, or no anko say, or no anko no say. Emfa ne ho kra ne ehia na ne se bosumindru na na allowance sembra bosumindru na ne ketua ba se aban on twa ne ka for 1 week crap on ne sika mbaya onyanka okotwa aban ne ti. You see, these are the people that we recruit into the system. And me, that's what I'm saying every day. Say, most of the people, not all the nurses, but some of them, the nursing is not their passion. Sometimes they decided to go into nursing because they have nothing to do. So, obvious school now, 1 year ni 33 grade binu, or new be akọ, and to why plan na agino or nursing na okotran na achen na sane pa no, is it ready to work? That they don't concern me. You know, if you must show, you know, if you can't tell me, say, it be me at the 33. You go. You know, before them bomb where they saw me last time I went to some hospital. So last time I go to hospital, my name self, they name the space self. They use capital, they use double B, you know, be 1B, but they do them like that. When in I can sing. What I say? Upon all that, those same people, they will not brum one say. Mu bram ho ase no mutio on bet chow ada pasa on bet na chow ada pasa. In fact, let's watch the video of the man, the doctor, and then come back.
Why do we have a problem sometimes with healthcare here? And it's about the way we treat the patient. In Ghana, for the last few years I've been talking about this. The nurses sometimes make you wonder why they are even in the hospital. The doctors make you wonder. And I'll say this for any healthcare worker who is listening to me. The hospital is for the care of the patient. It's not about you. It's not about me. It's not about the administrator. It's not about even the minister of health. It's about the patient. So if you're a nurse and a patient wants something, patient comes to you and wants something and you shout at the patient, you're doing the wrong thing. If you tell a woman who is in labor that, did I go there with you? Shut up. The nurses here will know what I mean. It's wrong. If you're a doctor and you ask the patient, why did you say you have malaria? Are you a doctor? And I've heard a situation where a doctor actually threw a chart at the patient for suggesting a diagnosis. I'm going to say this, and I'll say it again and again. Let us stop that kind of practice. Any health worker who insults patients should not be a health worker.
You hear what the doctor they talk? He said the way that they treat the patient at the hospital is very poor. He has been a senior doctor and is complaining. Now who come off from ever? What else? And it is true. Most of them saying that you do a work that you know, say, with passion. A juma way there, me destiny, say, me what I say. Nobody is forcing you to go into nursing. You chose that fate. Say that is your rule you are going to toe. So if that be your road you are going to toe, then that means anything involving that thing, you must be able to comply. But at the end of the day, you expect salary from the government. You go to the hospitals, you see them sitting down there, and when sometimes what makes me bore a lot is say you go to these expensive private hospitals, the way they attend to them, people will be very good. And it is some of the same nurses that are coming from the government hospital. They work at different private hospitals and they behave very well over there because they know that at that place, if you misbehave, they'll sack you. What I say? On him say or misbehavior, they best sack you. What I say? But when they come to the government sector, there was a time I made the Obiko hospital. I was there. It was late in the night, around 12 a.m., midnight. And I call hospital. Do you know, we got there, they prepared the bill and everything. I told them, oh, I don't have money on me, physical cash. So let me pay with Momo. They said no. They are not taking Momo. And I asked them, so should I leave the person and go? Because I have to do payment before I start treatment. And now you are telling me you don't take Momo and you accept only physical cash. You expect me. How will I get money to pay before you treat my patient that I come with? So you see, sir, some of the actions, they are deliberate. They decided, say, they go do. For instance, obi aba na onu so yare, no ko hu doctor. So yare there na ya malaria, we dey say malaria na ya. Obi ono yare about say malaria no. As a doctor, as a medical doctor, what do you have to do? Use your instrument. What I say? I feel na be say na we dey say malaria na ya. Nipa no yare on him say on nothing but him say malaria can say malaria na ya no. Charlie, these our health people, we have to take them serious. If those of them who don't have any passion of doing nursing, but they decide to go to nursing because they feel like there is no job, so they will go into nursing just to secure themselves some job. At the end of the day, they will go to the hospital and be playing FIFA games. Some of them they play FIFA game a lot. They play FIFA game or trabet, nurse or trabet. Or Tion on Casa on any web WhatsApp, the whole Tion WhatsApp. They are not making anything sensible there. When you go to them, there's a patch up. Let me say, ni so na sound. Me ba, they can't me ba. On your show, or Tion you fuck can oppress you. And I can there's a patch up. Me mamma ni yare no, I away you. And Tiba checky now it's only or see the kind. Now it's only just a sign. Yes, a sign. That's how they behave. We've witnessed a lot. So what the doctor is saying, I don't doubt it. You can tell a nurse, say, oh nurse, if I chop it me aboa me, na ma call you soccer crack. And then you do buy no okwain because of Phyllis want to be wow. But you are there for those things. You are there. Those things are part of your job. Say me back. Na say be check say me sperm no low sperm count and I say we are omo hia me sperm o say we so we no mommy bj. It's your duty. What I say to use your duty to do the thing, make the white water come and do your test. It's all part of your work. You can't tell me like for instance papa penyi be my example when papa penyi be go hospital. And your man I dare say onu sebita fracture onko ni no ti di bi e bi gum no fa bra no fa test lab test no be say nurse ni say e be hia wa ma me ko wa na ko ti preku na me be abroad hospital. It is true. So our nurses, our physician assistants that we are having in Ghana, we are begging you people, ye pamucho mubuaye. Try as much as to contain us because at the end of the one here, Obeka say Obi town, Obi and town. But this is an issue. It affected the health industry very well. Omo behaviors, omo response to patient, omo treatment are very poor, and they have to work on it. They have to work on it, Masa. Viewers. This is from the health center and it's from one of their senior doctor. You know, we meet they talk. They talk. If you have any issue, argue with your phone. Don't come and argue with me. Yes. So if I did your argument, argue on the phone. Text me or come to the comment section right there. Then we vibe. What I said. So please, the nurses insulting patients and treating patients poor, you have to desist from that. It's not good. Viewers, get to the comment section and let's vibe. This is Exhub Studio and it's your trending news. Thank you for staying with us.